I'm a primary care physician, as Sue mentioned. I've been here in this community about 3.5, almost 4 years. One thing she didn't tell about me, between the time I finished residency and the time I went to Bennettsville, I actually worked at Patrick Harris Hospital as a psychiatric physician, working as a primary doctor in that setting too. So we had a lot of different experiences. One of the some of the people I want to introduce today, Nadine Mulligan back here in the corner. She is one of our nurses at the wound care, and she's pretty much a specialist in how to take care of wounds. Holly Ward is in our what we call the HBO chamber. She's the technician that puts you into the dive and takes you down to about 60 feet below sea level. So that's what we use to help with the healing of the wounds. Ann is upstairs. She's our secretary. Jennifer, who is the director, is away for some training today, some continuing education and training. Now, what I'm going to do today is I'm going to speak from the perspective of a primary care physician, which is what I am. In our clinic, we have one surgeon, we have an internal medicine physician, I'm talking about the physicians, and we have a hospitalist, and then we have me, of course. We I think may add another physician soon. But the idea when this wound care center was developed was to get different physicians from different specialties to get different perspectives on how to do wound care. Now, we all went to the same training out in Texas to get some training through a company called Diversified, which has helped us develop this center. But the purpose for me as a primary care doctor in getting involved is I see people who lose pieces of their body from time to time. Have any of you ever seen anybody lose a foot? Anybody seen them lose a toe? Well, we can, you don't have to stand up. Testimony over here. All right. Now, in some of these slides we'll look at, the significance of losing part of your body can be as bad in terms of long-term longevity, in terms of how long you're going to live, as cancer. It's pretty serious because, of course, people who lose limbs often have other medical problems too. But as a primary care doctor, my job, I think, is to keep people well. And I want people to live as long as possible. Anybody in here in their 90s? 80s? Do we have some 80-year-olds? Yeah. And 70-year-olds. And so in my practice, we have a lot of people who are approaching 90 years old. I have a few approaching 100. And some of them, you know, as long as you still keep your mind, that's a pretty good thing. You can do a lot of things when you're 90 years old if you got a good brain working. So one of my goals as a primary care doctor is to help people stay well, which is why I got interested in the wound care thing, because when I was in medical school, we didn't get a lot of training in wound care. I remember the rotation I was on, they took us up to the upstairs of the hospital, gave us to the wound nurse for about 4 hours, and in 4 hours she was supposed to tell us everything we were supposed to know about wound care. Now, if you become a surgeon, you get a lot more training because they spend a lot of time debriding wounds, and of course those are the people that often take off the legs or the feet or the toes or whatever part they have to take off to save somebody's life. But in the wound care center, our philosophy, if we can avoid the loss of a toe or a foot or, you know, a piece of something, we prefer to try to keep it. Now, your job to help us is to help identify people in the community that need our help. And the reason I'm giving this presentation from a primary care perspective is because I want you to help us identify people in the Pickens and Greenville and Anderson area particularly, but we focusing on Pickens County a lot because this hospital has had a tradition of ministering or helping people in this region. And this is something that's new for this particular area, and there are a lot of people in Pickens County, unfortunately, that have diabetes. I won't ask if any of you have diabetes. I'll just ask if anyone knows anybody that has diabetes. Okay. Now, we'll talk about that in a minute, about how serious that can be in terms of affecting wounds. So let's get started with the slides. This, of course, is the name of our center, the Wound Care and Hyperbaric Center. Now, somebody tell me what hyperbaric is. What is that? Ever heard that word? When you get the bends, if you got too much nitrogen in your body, they put you in one of these chambers like on a ship and let you sit there in the chamber until the nitrogen which is in your body comes out and the oxygen comes in. And then you can come out of the chamber. Now, so we have a chamber upstairs. If you look right over here, and I'll show you a better picture in a minute. We have two of these things that are called hyperbaric chambers. Now, the purpose of them is not to prevent bends when you've been scuba diving, because we don't have too many people scuba diving in Lake Hartwell. Few people. But the purpose of what we have is to help you have extra oxygen put into your body so it goes to the wound wherever it is so it gets better quicker. Now, not every wound qualifies under Medicare rules for that, but about 15% of them do, and those are the ones we try to identify to get some help. So this is what we start about. This is kind of the outline of these slides. Now, I'm going to go through these 4 slides. First reason that wound care is important in Pickens County is because we're getting older. Is anyone in here getting younger? We got one. She's lost some weight, and unlike me. I've been working on a prescription to make people 10 years younger, but I haven't got it perfected yet. I thought I could probably retire if I did. Second thing, the higher rate of diabetes. Have any of you been to the schools recently, the grammar schools, and looked at the children? Are they heavier than they were when you went to school? What percentage, and I don't know this, but do you know, how many percent of our kids are overweight? Some people saying 50, 60%. They are, in family practice, they're telling me I'm supposed to check lipids, cholesterol on 11-year-olds. I'm supposed to start treating them with statins when they're teenagers. And I'm supposed to identify kids. I don't always do this, but you know, I'm supposed to identify kids overweight who are at risk for diabetes, which I do. It's hard if a kid is sitting around playing video games, eating pizza and chicken McNuggets and French fries every day and won't go outside to play because they'd rather stay inside. It's hard to get them to lose weight. When I was a kid, we played rolly bat. You know, most of the money of Medicare, and we can talk about that in a minute, most of the money of Medicare is spent in the last 15 days of life, but the other part is spent on people with chronic disease. Can you name a chronic disease? Parkinson's, all right. Multiple sclerosis. What else? Arthritis. I had one lady said she slept with Mr. Arthur every night. What are some other chronic diseases? You heard of congestive heart failure? What's the statistics on that one about how long you live once you get the diagnosis if you don't get treatment? 3 to 5 years. You don't get treated, you're going to be dead in 5 years if you get that diagnosis. I'm not here to scare anybody, but that's the truth. What about hypertension? Is that a chronic disease? I won't say how many of us have that. That might even put me in there somewhere. Obesity. Does anyone ever heard of body mass index? Yeah. Do you know what yours is?
Yeah, too much. 27.
How often do you weigh yourself?
Every day.
I don't. I weigh once a year. I'm too hard. I don't like knowing what I weigh. But you know, but I do know what my body mass index is. Every year And the way I tell my weight is by how many belt loops I have to loosen up. Now my wife and my daughter are on a diet right now, and so I've been having trouble finding something to eat. But this is a big deal. This stuff right here is where diabetes comes from for most of us. And so that can be a chronic problem. And people with a lot of weight have trouble with their joints. Any of you ever had a knee replacement? It's a good thing, but it's not something that you necessarily want to do if you don't have to. And a lot of it comes from either old injuries or weight. Okay. I don't know if you can see this. Can we dim the lights just a little? This is only for this slide. Just cut this one, yeah. All right. Now this one, have y'all finished eating? Oh, okay. Whoever hadn't finished can stop now. This is what's called a venous stasis ulcer. Somebody tell me what a venous stasis ulcer is. What happens when you have venous stasis? Ma'am?
Circulation problems.
Circulation problems. What else? Any of y'all ever had swelling in your ankles? Any of you had swelling where you ride in the car for a long time and your ankles swell up? Yep. That's venous stasis. That means you got too much fluid in one place. It's dependent on gravity, but it's also dependent on how well your vessels work coming back the other way. Your veins. You know, arteries go down, veins come up in the legs. Venous stasis is when the fluid gets in there and it won't go away. Now, there's a wonderful little pill called Lasix. Any of y'all ever taken Lasix?
Oh, yeah.
It makes you get close to the bathroom. I took a hydrochlorothiazide one day just to see what happened, and I peed for about 6 hours. Now, why is this a big deal? What keeps people's skin healthy? What keeps your skin healthy? Circulation. You got to have energy, just like we ate food so we'd have energy. We got glucose. What about oxygen? Oxygen, exercise makes the muscles work. The oxygen gets going through there. This leg is full of fluid, so the oxygen is not there, not as much as needed. The skin breaks down, it starts to weep fluid. And you ever seen anyone's leg weeping? And then if it does that long enough, it'll turn into this. We spend a lot of time on this kind of ulcer. Charles, and he told me I could tell about him, had this kind of ulcer for, you said 24 months?
Well, totally, I guess I thought like that.
About 2 years. Now, what happened with Charles, we first cleaned the wounds out, and then this lady in the back, she got in there the wraps. She does 2-layer wraps and 4-layer wraps and all kind of things. You have to be careful how much you wrap. If you put too much, throw the fluid up in your heart, you get in congestive heart failure. You put just enough, you get it up above the knee, kidney pumps it out to the bathroom. So it's important to know how much to wrap. Any of y'all ever had Ted hose? Now, this thing over here is called a pressure ulcer, and that appears to be a buttock, if I can. I didn't mean to have a bad slide in there, but anyway. Have any of y'all ever, I used to visit, still do some, but not as much as I used to, but in the nursing home and visit people in my church, taking communion and things. And a lot of times we'd run into this kind of trouble. They'd be in the bed so much that simply the pressure of their body pushing on the bone, like the butt here, or one of the prominent places like the hips, or even the back, and they'd get these ulcers. Another place is the heels of down here on the feet. You ever seen people have the little booties on? The purpose of that is to, have you ever had an egg crate mattress? what do they have now? The air, I think they have air and egg crate. Anyway, when you get these kind of things, they shear, the friction shears off the skin, makes a friction spot like a rug burn. It turns into 1, 2, 3, 4 stage. Sometimes it goes all the way down to the bone. Of course, you want to catch it early so you don't have to have surgery to have it taken out or fixed. Nadine, tell them about a wound vac, how that works.
A wound vac is what we use for
You can't get them well, you know, that's an alternative.
Let me just interrupt. Our clinic is...
If it's not something we can help you with, we'll get you to somewhere that can. But we've had a few people with special vascular issues we had to refer out, and then they came back later. This thing here is called osteoradionecrosis. Somebody to help me understand what that is. Osteo, bone, radio, could be radiation, couldn't it? Necrosis means it's dead or rotten. All right. Any of y'all know anybody had radiation therapy like 20, 25, 30 years ago? It used to be fairly common. A woman would have her breast taken off and she'd have radiation, a lot of it. Sometimes radiation 20 years later causes people to have skin breakdown and wounds. And that's a special kind of wound. Some of these wounds end up in the hyperbaric chamber in order to get well. But that's another kind of wound. And this is our favorite wound over here. Diabetic foot ulcer. That's the one that often we're trying to salvage a limb. Now what happens when you get an infection, if you have diabetes, have you ever heard of a thing called peripheral neuropathy? What is that? Tingling, burning. What happens when you lose all the feeling? Well, suppose you're walking around in the house. A lot of people have this shag carpet, walking around the house, no shoes on, pick up a piece of glass. They don't know it's in there. 2 months later, the glass has worked its way up to the bone. All of a sudden, the skin starts to break down. They got a big hole. Ends up with something like that. Now, there's a difference in having a wound that is in the bone, the infection in the bone, and one that's outside the bone. The one in the bone is called osteomyelitis. Y'all heard of that? The ones outside the bone are just standard wounds, but they can be infected, but they're not quite as serious. What happens when that bone gets infected? What do you have to do for it? Your choices are cut it out, whack it off. That's the simplest way. You just go to a surgeon, and I'm not speaking for or against surgeon. I'm just saying go to a surgeon. They say, we got to take this thing off. It's going to kill you. And often that's the truth. Some of these, however, can be salvaged, and that's when we try to get involved and get people in the hyperbaric chamber. And the oxygen plus some antibiotics going to this place can sometimes turn that thing around so you don't lose your foot. And that's why we have these 2 chambers upstairs. That's a real bad situation if you're diabetic, your sugar's out of control, you got a hole in the foot gets infected, the infection goes from there to the bone, and the surgeon comes in and says, I think we're going to have to take off half your foot. Often what happens 3 months later, 6 months, a year later, they may have to take off some more. Now, this is sounding awful depressing. I'm sorry. I hate to be depressive. I'll get to better stuff in a little bit. But this is what we do. And we look at it as a ministry to people because I don't know, he's lost is it below the knee? Yeah. When did that happen?
I'm 2 years out.
2 years out.
January was 2 years, yeah.
Has it changed your life in any way to have? Tell, what's the difference? You feel better. What happens when you lose a leg and you get a prosthesis? You have to retrain yourself how to walk.
Not through yet.
Not through yet. Are you able to play golf? Still play golf?
I have not tried that. I wouldn't. I know that. My biggest problem is walking outside, like
Okay.
where you'd be on a golf course.
All right.
I can walk pretty good and you're on a level surface, level floor.
Did you get the?
Yeah.
All right.
I get outside, don't work good.
There's a lot of new things happening. I know my wife's father, when he was living, he had lost his left leg right here, and he loved golf, and so he taught himself to hit the golf ball standing on one leg, and could hit it 250 yards straight. He beat all of us. When he had his leg on, he could beat us a whole lot worse. But he developed tremendous upper body strength, but it took him about 5 years to do it. So that's another kind of wound. Now this is a graph of where diabetes is going to go by 2050 if we keep eating McDonald's cheeseburgers all the time. That's a lot of people. We're up around 30 million by then, whereas we've been around back in 1960, 3 million, 10 times more. Now, in terms of hospital care, if you have a wound that either develops in the hospital or you're having to be treated in the hospital, this is inpatient instead of outpatient, it's going to add about $5,400 to your bill. It doesn't, it's probably not going to come out of your pocket, but it does increase the cost of care. So we're trying to find ways to have lesser costs. Peripheral artery disease, ischemic ulcer, compared to lung cancer and pancreatic cancer in terms of how quickly people die from it, 30% of chronic wounds left untreated either have amputation, and 47% of people who have amputation die within 5 years. That's what we're trying to change. So that's the big deal. That's why if you have somebody who has one of these wounds, the quicker you can get them some help, the more chance we have to salvage a limb and also for them to survive. Here's the kind of wounds. I'm not going to talk about all these, but just look at I think there's 12 of them. Venous, pressure, diabetic, arterial, vascular, delayed radiation, necrotizing. Do y'all know what necrotizing fasciitis is? Where you get an infection and it goes so fast it just goes around the body in 24 hours, kills people real fast. Some of these new infections, some of we try to take care of some of that stuff in the wound center to try to get people turn it back. Sometimes we use hyperbaric. Surgical wounds, sometimes surgeries get infected. Neuropathic ulcer means places where you don't feel. Now this is just a slide that Jennifer had for me to say that we should try to involve all the specialties to help identify people. What do we look for when we are going to try to fix a wound? First of all, you got to have blood flow to the area. Second, you take out the bad tissue. Third, you treat infections. Fourth, you try to get rid of the fluid. Fifth, you try to enhance the wound so it's likely to heal quicker. Same way on number 6, pressure offloading. How many of you have ever seen anyone that had a boot on that was out trying to work in their garden or out around the house? The purpose of having on a boot is to protect the wound or whatever's gone wrong with your foot. Some people, when they get the treatment, they just go right back to what they were doing. They don't take enough rest, and they get these big calluses around the wound, and then we have to go back and redo it the next week. We try to get people special shoes so that the pressure of standing up gets transferred around the wound so it doesn't affect the wound itself. So the wound can heal even though people want to, keep walking around. Mr. Finley mentioned about pain. When you come to see us, we don't want you to hurt. It's a scary thing to have somebody down there scraping on your leg while so we numb you up with this lidocaine and some other things. And if we do it right, you don't hurt. So if you're there and you're hurting and you tell us, we stop. We go to someone else, we give you some more numbing medicine, and we continue. And then host factors. Some of these, we now have some tissue that we can use to put over a wound that's similar to a graft. Any of y'all ever seen a skin graft? There's a new thing, it's called apple graft, and there's another type as well. You ever wonder what happens to the little boys' circumcisions when they got through with them? Used to be they threw them away. Now they take them, and one circumcision can grow a football field worth of skin. And that's what they use now to make these apple grafts that we put over places that won't heal. We talked about hyperbaric. My wife says sometimes I don't have good sense what I say, but anyway, if I say anything that upsets you, tell me about it. We talked about the wraps, the negative pressure. The doctors are responsible for whatever happens. We spend a lot of our time cutting, draining. A lot of the surgeons help us. We work with the surgeons. If you need to have something that's too big for us to handle, we send you to the to the surgical suite with the surgeon who puts you to sleep, cleans it out, sends you back to us. If you don't have good blood flow, we send you to the vascular doctor. We use Dr. Jorgensen over here, which is right across the street, Carolina Cardiology. He takes you, he checks out to see if you got good blood flow coming up and down. And we do tests also in the hospital. But if there's a problem, we take care of it before we proceed. We don't want to treat somebody with wound care if they can't heal. So we do a lot of tests to be sure you're going to be able to heal. We take biopsies of wounds looking for bacteria. We have a way to, it's called a T-comp, where if we need to know how much oxygen is coming into that particular limb, we can put this thing on there and test you and determine if you have enough oxygen to get better. Venous studies, of course, this is what I was talking about, the bioengineering and the negative pressure. Now, this is the chamber over here. Have any of you ever been in a submarine? You have? Someone? What's it like when you go down under the water?
I don't like.
Did your ears pop?
Yes.
All right, so there's a change in pressure. Now what happens when we dive somebody, and we don't have the horn to go where you pull the horn like they do on the sub where they dive, you know, maybe we should get us a big horn, and every time somebody dives we could pull a horn, you know, but we dive you to 60 feet, keep you down there for 90 minutes and bring you back up. Now, what happens to your ears with pressure? Well, before anybody goes in, the physician is responsible to check the ears. If your ears are not in good shape, we don't put you in there. If we have problems when you go in there, we get one of our ear, nose, and throat doctors, Dr. Waters or Clayton, to put a little tube in there, and that fixes it. So you shouldn't have to worry about that. The hardest part of that is having to watch the late afternoon TV, the soap operas and stuff. That would drive me crazy if I had to do that. But you get to pick out what you want to watch on the TV. I watched a little bit of it one time, and I had to leave the room. I couldn't take it. But you know, that's what we do. There's a lot more to that, but it's done in a very safe environment. We have lots of rules. If there's any danger, we don't do it. And this, of course, talks about the Undersea Hyperbaric Medical Society requirements. We had to go through this week-long test and training down there to be able to even supervise it. Now, we use a lot of guidelines. These guidelines have been developed for this particular clinic over the last 15 or 20 years, and they're called what's called evidence-based medicine. This is a big term in medicine now. They're trying to be sure that what we do is not based just on what we call anecdotal or talk data, but actually has been proven to be useful. And Medicare and the other insurance companies are not wanting to pay for anything just because the doctor orders it. They want to pay for it if it's going to do some help. Have any of you ever been turned down for a medicine or had to change medicines because the insurance company said, I'm not paying for that? I think I spend every day helping people get that straight, trying to save them money. Well, they won't pay for stuff that doesn't work. And these things have been proven to work. Now, if you want to have something to read at night, I'll make you a copy of this little slide over here. That's what we have to do. But we go through these 9 steps every time for everybody before we do anything. It says here the referring physician, but really when I was in the pastorate, if I had anything that I wanted to get done in the church, I didn't go through the board of elders because they were all men. I went to the women's auxiliary group. I'd find whoever was in charge or whatever we needed. I say, could y'all get this worked on and come back and help me get this accomplished? And they would go discuss it, and if they thought it was a good idea, then they'd tell their husbands at night, and next thing we know, we had a vote in the session, we could get it done. So I'm not sure if your church runs like that or not. We eventually had some women on the board too. But you know, what we need you to do is, like I said in the beginning, help us identify the people that need the treatment. This is a resource for this community and for this hospital and for you. And the reason that I am involved is because I think it's a very good thing. I'm going to try to finish real quick. This is what it says. If you have a wound that hasn't made progress in 2 weeks, then you need to come. And that would, or you know, and you can even not completely healed in 4.